Institute for Tropical Medicine learned that 40 of their employees have contracted the new coronavirus. We now talk to Health Undersecretary and Spokesperson Maria Rosario Vergeire. Ma'am, good morning. Thank you for taking our call.
Yes, ma'am. Good morning.
Ma'am, it is quite concerning that a number of RITM staff are now infected with COVID-19 because they're the ones literally dealing or handling the coronavirus. How dangerous is this situation for people at RITM, especially those who work in the labs?
Well, as long as proper infection control procedures are being implemented, it should not be that risky. That's why we are reiterating to all of those applying for to become laboratories for COVID testing centers that it should be that they should be following the protocols that we are implementing so that this kind of risk should be minimized. So it is quite dangerous for, of course, the risk is always there for laboratory people to acquire this disease. But for our ITM, they are still investigating as to the source of infection, and initial results of the report would point to that to those people who have gone home and went back to our ITM and has mingled with the other staff of the laboratory. So it's not really coming from the laboratory itself, but from people who came out and went back to the laboratory.
Okay, so it is not at this point definitive that the infections came from the lab. Ma'am, can you tell us of the 40 who have tested positive for COVID-19, how many of them are people who actually work in the lab?
We still have not received the official report coming from our ITM as to the number of these people who have who came from the lab and who came from the hospital. They would still have to report to us the official investigation that they have conducted.
Ma'am, I understand that when the doctors from Wuhan came to the Philippines, they did visit RITM. What were their comments regarding the facility? Was it up to the necessary standards of safety?
Yes, ma'am. When the experts went here, our ITM was given a good clearance that it was up to par to standards for infection control.
All right. So, ma'am, we can say that those infected did and do have the complete PPEs to protect them against the virus.
Of course, of course. Our ITM is our national reference laboratory, and therefore they practice these infection control procedures. And it is just unfortunate that this kind of infection has happened within our ITM. But for now, as I've said, initial reports would point that it did not come from their processes, but really from mingling of people during break times and during going out of the office.
Ma'am, we know that contact tracing is key when it comes to containing this pandemic. Has contact tracing been carried out, and how many have been identified and have been asked to undergo testing or be on home quarantine?
Yes, that's the reason why our ITM has scaled down its processes. Since Saturday, they've started scaling down processes, and it's going to last until Friday because they are trying to decontaminate and trace the contacts of these people who were infected here in our ITM. As I've said, we have yet to receive the official report because as of yesterday, they were still trying to do the contact tracing and investigation.
Ma'am, we talked to our ITM Director, Celia Carlos, yesterday, and she said that they're prioritizing first the processing of the test results of our ITM employees before handling external samples. What does it mean now that our ITM is unable to process test kits as usual?
Yes, let's just be clear. Our ITM scaled down their operations, but they did not close. So they are still processing, but they have just scaled down. So the number of those assigned to them, the hospitals and the communities, were decreased. And we have distributed these assignments or assigned areas to other subnational laboratories. So they are still processing testing or tests that had been submitted to them by the assigned areas for now, temporary assigned areas to them. And then by Saturday, this coming Saturday, they would be fully functional again.
Yusek, where are we really now in this fight against COVID-19? Have we reached the peak of cases? Are we near flattening the curve?
It is still being studied. It is being evaluated by our scientists and by our partners as to what really is our status as of now. So currently, all I can say is that cases are still increasing, the deaths are still there, and our health system is still trying to cope with this increase of cases that we have.
Before I let you go, Yusek, we understand the DOH is now hiring physicians, nurses, medical technologists, and other support health personnel to help fight COVID-19. For those who are interested, how can they apply? What are the requirements and benefits?
There is this agency hiring that is included in the Bayanihan Act, which the President has recently signed, and this is to include a number of medical professionals that would be working in the facilities that we have established, like the mega facilities, and of course, our priority are the referral hospitals for COVID. Their benefits would include, it's the same plantilla position where the salaries are the same. They have these extra benefits as incentives as for hazard. They have PhilHealth benefits. They have GSIS insurance. And also when they get sick, they would have 100,000 as benefits. And of course, not to have, let's pray that it doesn't happen, but if it happens, they would have a 1 million benefit for their family. So these are the benefits that they would be receiving. And they just need to log on to the numbers and the email addresses that we have provided in our web to be able to apply.
All right. Thank you for that. We do appreciate your time this morning, Yusek Vergeire of the DOH.